Welcome to the paper of Jacqueline, Detert and Pascal Klaus for the topic Biologic monotherapy in the treatment of rheumatoid arthritis. This paper was given from the Department of Rheumatology and Clinical Immunology of the clinical group of Professor Gerd Burmeister from Berlin. The rheumatoid arthritis is an autoimmune disorder and a chronic disease. It affects 5 or more joints, and 0.5 to 1% of adults worldwide suffers from them. This disease is characterized by persistent synovitis, systemic inflammation, and development of autoantibodies. The goal of treatment in rheumatoid arthritis management is to achieve a remission or very low disease activity. As a first step, the start is treated with a conventional synthetic disease-modifying antirheumatic drug therapy with or without concomitant glucocorticoid therapy recommended in order to achieve this goal. Methotrexate remains the standard therapy for rheumatoid arthritis, but despite the introduction of other conventional DMARDs, the remission rate for methotrexate treatment is below 65%. Biologics affect pro-inflammatory factors such as cytokines, cytokine receptors, and specific inflammatory cell types. High-cost biological treatments are usually reserved for use if conventional DMARDs are ineffective, contraindicated, in cases of non-response, in cases of drug-induced adverse events, or bad compliance of the patients. Approximately 30 to 33.6% of patients with rheumatoid arthritis treated with biologics as monotherapy. These data are supported by various observation registers. But following adds, principle is always the first treatment preferable to conventional DMARDs because a sufficiency treatment is possible for most patients and treatment with biologics are very costly. Also shows the previous long-term data that especially combination treatments are often more effective than monotherapy. This review presents an overview of the trial data currently available for biologics monotherapy. For many of the shown clinical trial data, a comparison with the treatment of a biological monotherapy was not taken. If you like to have some contact with the authors of this paper, feel free to use the email of jacqueline.detert@charity.de. Thank you for your attention.